Hi, I'm Tanya, and in this presentation, I'm going to talk about the psychology of stress. This presentation is divided into three sections. First, body responses. Then we will look at the relationship between stress and illness. And finally, the biological and psychological methods used to reduce stress. Body's responses to stress. What is stress? According to the World Health Organization 2023, stress is a state of anxiety or psychological strain caused by challenging circumstances. It is a natural human response that drives individuals to face obstacles and dangers, affecting everyone to varying degrees. People respond to stress in various ways, with coping methods and stress manifestations differing significantly. Stresses significantly affect mood, well-being, behavior, and health. In young, healthy individuals, acute stress can be beneficial, but chronic stress, especially in older or less healthy individuals, can lead to serious health issues. The link between psychosocial stressors and disease depends on the stressor's characteristics, frequencies, duration, and the individual's genetics. A stressful event can cause an increased heart rate, rapid breathing, tense muscles, and sweating. The fight or flight response. The fight or flight response is an evolved mechanism that enables quick reactions to danger, enhancing survival. This rapid sequence of hormonal and physiological changes prepares individuals to confront threats or escape. However, the body can also overreact to non-life threatening stresses like traffic, work demands, and family issues. Researchers have revealed that the mechanisms behind stress reactions and the lasting effects of chronic stress on physical and mental health. Prolonged activation of the stress response can disrupt bodily functions, leading to issues like high blood pressure, atherosclerosis, and changes in brain function associated with anxiety, depression, and addiction. Emerging studies also suggest that chronic stress may contribute to obesity by increasing food intake or reducing sleep quality and physical activities. Types of stress. Stress is often viewed negatively, but Hans Seeley introduced the concept of eustress or beneficial stress. Seeley and other scholars, including Lazarus, argued that not all stress is harmful. De-stress is a harmful stress response marked by negative emotions and physiological reactions occurring when individuals feel overwhelmed by demands, losses, or threats. It can trigger health risks, especially when combined with poor coping strategies. Eustress is a positive form of stress that occurs during enjoyable and challenging activities like sports or presentations. It promotes personal growth, skill development, and a sense of accomplishment. Body's responses to stress. The SAM pathway activates the sympathetic division of the autonomic nervous system in response to acute stress. It starts in the hypothalamus, stimulating the adrenal medulla to release adrenaline and noradrenaline. This leads to increased heart rate and blood pressure, enhancing oxygen delivery to muscles for improved physical performance, preparing the body for a flight or fight response. Research indicates that gender differences exist in individuals' responses to acute stressors. For instance, Taylor et al. Discovered that acute stress triggers a fight or flight responses in men, whereas women it tend to exhibit a tend and befriend response. This divergence can be attributed to the higher levels of oxytocin produced by women. a hormone associated with relaxation and nurturing behaviors. Consequently, this evidence implies that the acute stress responses varies among individuals and should not be as presumed that all people will exhibit identical physiological reactions to acute stresses. The HPA axis. The HPA axis is a communication network involving the hypothalamus, the pituitary gland, and adrenal glands, crucial for regulating the body's stress response. The HPA axis primarily releases cortisol, a glucocorticoid hormone, triggering immediate physiological changes for stress response, which is an involuntary and instinctive mechanism. Research highlights the crucial role of the HPA stress response in human adaptive behaviors. Research shows that prolonged activation of the HPA axis can lead to Cushing's syndrome, which includes weight gain, cognitive impairments, and mood disturbances due to the elevated cortisol levels from extended stress. While the stress response is typically seen as adaptive for confronting threats, chronic exposure can harm immune function and overall health, suggesting it may hinder survival. GAS, General Adaptive Syndrome, describes the body's physiological response to stress occurring in three stages: the alarm reaction, fight or flight. The activation of the sympathetic nervous system occurs due to the abrupt secretion of hormones. 2. The resistance phase, recovery. As stress persists, the body moves past the initial alarm phase and adapts. Sympathetic nervous system activity decreases, reducing adrenaline and noradrenaline secretion. However, hormone production from the adrenal cortex increases, regulated by the ACTH hormone from the hypothalamus. This leads to higher cortisol levels, raising blood sugar to provide energy to combat the stressor. Exhaustion. Chronic stress bodily resources, impair adrenal function, and lower blood sugar levels, leading to health issues like hypertension, cardiovascular diseases, and ulcers. Prolonged stress can lead to significant and physical and psychological effects, increasing the risk of lasting harm as the body cycles through these stages. A key strength of the general adaptation syndrome model is its empirical foundation. Factors of stress. Many factors contribute to an individual's daily stress, some which are manageable, while others are not. Stress sources affect people differently. What is a major stressor for one may not be for another. Stress can stem from internal factors like anxiety, insomnia, and ill health, as well as external factors such as daily challenges, your environment, and relationships. Eustress, a beneficial type of stress, can offer emotional advantages when it is brief, motivating, manageable, exciting, and enhances concentration and performance. It is also helpful when it triggers the fight or flight response. Individuals may experience various stress-related symptoms that vary in intensity depending on the stressor. Ray and Wise-Johnstone identify 7 domains of stress. Symptoms: affective, example, anger, shame. Behavioral, such as aggression, appetite changes, insomnia. Biological or physiological, examples such as increased heart rate, muscle intention, nausea. Cognitive, such as frustration, difficulty concentrating, and imaginal. Example, feelings of helplessness, embarrassment. Also interpersonal, examples like argumentative, behavioral, or social withdrawal, and also sensory. such as feelings of nausea, cold sweats, and muscle tension. The relationship between stress and illness. The Brady study in 1958. The study of monkeys have provided key insights into stress and health. In an experiment by neuroscientist Joseph Brady in 1958, a group of monkeys, Group A, received electric shocks every 20 seconds for 6 hours, while another group of monkeys, Group B, could avoid the shocks by pressing a lever. The Group A monkeys ultimately developed stomach ulcers and died, highlighting the significant health risks associated with stress. This research highlighted the link between stress and ulcer development, a notion supported by Wiener et al. In 1957 in a study of military recruits. A key limitation of Brady's study is that the monkeys in the experiment were not randomly selected. They were chosen for their faster learning of avoidance responses, which may parallel certain human behaviors. Marshall et al. In 1985 challenged the validity of the findings, providing evidence that bacteria is an alternative cause of stomach ulcers. While stress may contribute to ulcers, it risks being seen as the sole factor. Marshall was so convinced of the bacterium's role in what led to the development of ulcers in the monkeys that he infected himself with the bacteria and developed ulcers. The Keikart and Glaser study in 1984 was based on medical students, 49 males and 26 females, during exam seasons. Blood samples was taken just before the first exam and then taken the day before their final exams. Keikart and Glaser et al. Found that natural killer cell activity had declined between the two samples, confirming other research findings that stress is associated with a reduced immune response. Volunteers were evaluated using behavioral metrics and completed questionnaires assessing psychiatric symptoms, loneliness, and significant life events based on theories linking these factors to increased stress. This study has notable strengths, primarily as a natural experiment which reduces ethical concerns, but also means it isn't a true experimental design. Thus, we can assert a negative correlation between stress and immune response, indicating that as one increases, the other decreases, but we cannot definitively conclude causation. The Cohen Study, 1993. After administering questionnaires on stressful life events, perceived stress, and negative effects, 394 participants were exposed to the common cold virus and quarantined to monitor for illness. The results supported the hypothesis that the psychological stress increases vulnerability to infections, as the higher the scores were on the stress index, which correlated with a greater likelihood of developing of the cold. The study faced methodical and ethical issues such as stress index as the independent variable was not manipulated, preventing a clear cause and effect relationship. Clinical research in psychology and medicine follows strict ethical standards with specialized committees evaluating each participant. The Brady 1958 study suggests that there is evidence of human effects of stress. The study was unethical as great distress was imposed upon the monkeys. They should have been euthanized immediately, therefore breaches the point 5 of the guidelines of ethical conduct and care of use of animals. The Cohen 1993 study also raised ethical concerns as participants were intentionally infected with the common cold, exposing them to potential harm. However, Cohen et al. Did confirm the health status of all participants before the study began. The Keikart-Glaser study correlates with the Brady study that humans are impacted by short-term stress. However, with the Keikart-Glaser study, it also had issues such as the participants were medical students, likely accustomed to high stress, which may influence the research objectives and reveal demand characteristics, potentially compromising the findings' validity. Also, the limited sample size makes it unrepresentative of the population, so the findings can be extrapolated. Like the findings of these studies, there are limitations that highlight the need for further research. While some studies indicate that the stress negativity impacts the body, they do not adequately explain the underlying mechanisms. This underscores the need for a deeper investigation into the relationship between stress and its physiological effects. Reduction of stress, biological and physiological. Biofeedback is a complementary therapy that helps individuals control involuntary physiological processes like heart rate and respiration. It is effective for managing conditions such as chronic pain disorders like epilepsy or PTSD, high blood pressure, and incontinence. In a biofeedback session, the practitioner uses non-invasive devices to monitor involuntary physiological functions like heart rate and muscle tension. Then the practitioner guides individuals on how to consciously modify these processes. With education and practice, individuals can learn to regulate these responses long term and independently. The main challenge of biofeedback treatment is the lack of conclusive evidence for its effectiveness. While many studies show positive results for biofeedback, its non-invasive nature makes it difficult for researchers to gather solid data on the outcomes. Benzodiazepines, benzos, are medications that reduce brain and the central nervous system activity and enhance GABA, the gamma aminobutyric acid. This psychoactive drug is primarily used to manage anxiety, mental health disorders, and neurological conditions like seizures. According to the Cleveland Clinic in 2023, benzodiazepines are commonly described since the 1960s, resulting in extensive research and thorough understanding of these medications are making them so much safer than their predecessors, barbiturates. Baldwin et al. 2014 states that benzos can cause sedation, cognitive impairment, and anterograde amnesia, affecting the formation of new memories. Benzodiazepines can impair driving performance to meet the UK legal limit. The main challenge of biofeedback treatment is the lack of conclusive evidence for its effectiveness. While many studies show positive results for biofeedback, its non-invasive nature makes it difficult for researchers to gather solid data on outcomes. Biofeedback is selective and may not be suitable for everyone, particularly those with certain medical conditions like cardiac irregularities or specific skin disorders. While benzos are strong, effectual results for patients, paradoxically, it is also its weakness, as diverse side effects outweigh the drug's benefits. The practical considerations of employing biological method of biofeedback and the psychological method involving benzodiazepines warrant careful deliberation prior to initiating treatment. Thank you for listening to my presentation.